Give us your best estimate about what we're heading for here and what you would have us do to get ready for it.
Well, David, thanks for having me. As we look forward to the winter, what we have to look at is where we've been the last couple of years with COVID, which is that each year we have seen an increase in COVID cases in wintertime, and we should be prepared for that happening this winter as well. Typically in the winter, we also see flu cases rise, and in some parts of the country, we're already starting to see that increase in flu cases. This is why it's so important that everyone take the precautions that they can to protect themselves against the worst outcomes of both COVID and flu. And in this case, that's getting vaccinated for both. The good news is we have updated COVID vaccines that people can take now that are targeted in particular for the BA.5 variant of COVID. That's the dominant strain right now circulating the US. And if you're at least 2 months out from your last shot, you're eligible to take those as long as you're 5 years of age and up. So I would encourage folks to do that. And to also you get your flu shot. You can get them both at the same time. That's in fact what I did. And that'll give you your best protection against hospitalization and death from this virus during this winter.
Doctor, do you have up-to-date numbers on the extent to which people are getting that? Is the bivalent version, right, that address BA.5, that newest version of the booster? What kind of take-up are you getting on that?
Well, we've actually been seeing the uptake increase. Millions of people have already gotten the vaccine. We anticipate more will, especially over the next few weeks as winter gets closer. We want everyone, though, to get vaccinated as quickly as they can, especially because look, we can't predict with great precision the exact day, that somebody may get ill. The best thing that we can do is to prepare because, there's still virus circulating. And I will say this also, that we've learned a lot in the last couple of years about COVID-19 and come a long way. We've actually been able to save hundreds of thousands of lives because people have gotten vaccinated and they've got protection on board. But even though we've made tremendous progress and we've been able to get back so much of our lives, it's important that we maintain this protection that many of us have. And that's where the vaccines come in. What we've seen, especially in folks who are older, David, is that if you are vaccinated, your chances of actually ending up in the hospital or dying from COVID-19 are dramatically lower. And finally, just keep this in mind, too. Even if you do get vaccinated, whether you do or not, there are treatments available for COVID-19 that we want people to know about. And if you are in a higher risk group, if you're older, or if you've got multiple medical conditions that put you at higher risk, know that there are medications available like Paxlovid, which you can reach for and which also dramatically reduce the chances that you will end up in the hospital or get sick if you have an infection.
Dr. Murthy, let's turn to something that is, to some extent, a separate issue, and I know our priority areas, but also is linked, I believe, to some extent, and that's our mental health. I know that's something you've really wanted to make a priority of yours, and there are reports now that the mental health in general across the country is suffering a bit, in part because of the pandemic. Where are we on mental health in this country?
Well, I'm glad that you asked, David, because a lot of people are really struggling right now when it comes to their mental health and well-being. COVID certainly has been a factor there. It's taken a toll. We've seen rates of anxiety and depression increase across the population, particularly among young people. But the truth is, even before the pandemic, we were struggling as a country, especially with kids. Keep this number in mind. We've had a 57% increase in the suicide rate among young people in the decade prior to the pandemic. And this is one of the reasons why I've made mental health and well-being my priority as Surgeon General, because this is really the foundation of society. Our mental health impacts how we show up in the workplace, how we show up at school, how we show up for our families and our communities. And that's one of the reasons why yesterday I released a framework on workplace mental health and well-being. It's the first time this has ever been released from the Office of the Surgeon General, but I did so because we've realized that workplaces actually have a powerful impact on mental health. And we are now seeing that 81% of workers are saying that they want to work in a place that supports mental health and well-being. When you actually make that investment in mental health, and we lay out 5 key essentials through which you can do so by investing in protecting workers from harm and building social connection and community in the workplace, helping support work-life harmony, supporting opportunities for growth, and helping people understand the value of their work and that they are valued at work. If you do this, you build a foundation for mental health that not only helps workers, but it turns out the data is increasingly showing us it helps the bottom line of businesses, increases productivity, as well as retention, which we know is an important cost center for workplaces.
Okay, let me ask the toughest question, I think, Doctor. It may be an unfair question. We have in this country a substantial and growing problem with people experiencing homelessness. And what I've read is there's a fairly high coincidence between mental health issues, substance abuse, and many of the people experiencing homelessness. What should we be doing as a society to address those that really need help who are out on the street?
Well, it's a critical question, David, and these go together. You know, as a doctor, I've cared for many patients who are homeless over the years, and I've seen that many of them have struggled with mental health concerns. And these two can often go together. You know, sometimes people who are struggling with severe mental illness are at greater risk of being left out, in a sense, and falling through the cracks. And homelessness is one end result of that. But we also know the experience of homelessness itself is incredibly stressful. And if you're somebody who's had depression before, or if you're prone to anxiety, then that a stressful experience can really push you over. So what we need to do is several things. One, we've got to make mental health care more accessible to people. And there's steps we've already taken over the last year and a half through the American Rescue Plan and specific measures to expand access to certified community behavioral health centers that will help in that regard. And technology is an important part of it. Technology helps us make mental health care available to people, even if they're not around a provider. But we've also got to address homelessness itself. And that means making sure people have places where they can actually live, have a roof over their heads, be protected from the elements, and making sure those places connect them to care. That's also going to be an essential part of the solution.